Hello, today we're going to talk about two topics, very interesting topic about the surgical diseases. The first one is going to be about the gallbladder disease, and the second one, the appendix, and what's the new thing about the treatment of appendicitis. So we'll talk about the gallbladder disease first. The gallbladder disease is gallbladder is an organ located below the liver and usually located in the right side of the abdomen. Now, what's the function of the gallbladder exactly? This is what the misleading thing. That's why I'm talking about the gallbladder. Most of the people, they think the gallbladder, that the one who secrete the liver juice, which is the enzymes from the liver to digest the food. Actually, the enzymes that, or the bile, which is secreted by the liver and stored in the gallbladder. So the gallbladder, the main function of the gallbladder is the storage. It does not have any secretory function. It's the main function of the gallbladder is to store the bile which is secreted by the liver. What's the function of the bile? The bile is actually the liver secrete the bile, and the bile we use to digest fat. So this is the main function of the bile. So now, what's the problem with the gallbladder? The gallbladder can have multiple problems, which include you have sometimes inflammation of the gallbladder, we call it cholecystitis, or the patient has developed tumors in the gallbladder, we call it polyps or cancer, or the patient can develop stones, which is the most common. The stone in the gallbladder is the most common, and 40% of the population of anywhere you go, that they will have more or less a stone in their gallbladder. Now, if the patient has gallstones, which is a stone inside the gallbladder, do we have to do anything for that? No. Not every gallstones in the gallbladder we have to be removed or surgically removed. The main thing of the intervention for gallstones is the symptoms. When the patient develops symptoms of the gallbladder stones, then the surgical treatment will be important. So what the symptoms of the gallstones? The symptoms of gallstones is abdominal pain, especially after eating. The pain is located in the right side and usually goes to the back or to the shoulder. So this is the main symptoms of the gallstones. Also, it's associated with nausea or vomiting sometimes, and the patients, especially the pain comes if he eats late or he has heavy meal. Now, if he has this kind of symptoms, and we confirm the diagnosis of gallstones by doing, first of all, lab test, which make sure the liver function is normal, and make sure that the stone has not moved to the common bile duct, which can cause obstruction. Now, after doing the liver function test, we'll do ultrasound. The ultrasound is the main investigation we do if we suspect gallstones. Now, the ultrasound will show us if there is a gallstones, the size. It'll show us if there is any inflammation of the wall of the gallbladder, and also it will show us if there is any polyps or masses inside the gallbladder. Now, if we do the diagnosis by the LFT, the liver function test, and the ultrasound, then we'll proceed the treatment. The treatment for gallstones is surgical, meaning that we have to remove the gallbladder and the stone inside it. We can't only remove the stone. We can't do lithotripsy, which is the breakdown of the stone. Why? Because if you break down of the gallstones, it might cause other problems, which cause maybe obstruction of the common bile duct, which is the duct that take the bile from the liver to the gut. Also, it might cause pancreatitis, which is the organ that's close to the gallbladder. So this is why we don't break down the stones. We always have to do a surgical treatment. Surgical treatment through the laparoscopic cholecystectomy, which is an easy and straightforward procedure in expert hand, of course, and it will be done through 3 to 4 keyholes in the abdomen. It will take about 30 minutes to 45 minutes, and the patient usually can go home on the same day or the next day. What we do remove the gallbladder and the stones. This is briefly about the gallbladder and the problem associated with it, and the treatment we use to treat gallbladder disease, which is the most common, the gallstones, which is treated surgically. Now we finished from the first topic. We're going to come back again for the next topic after the break. Welcome back. So we're going to talk about the second topic, which is going to be appendicitis, which is the inflammation of the appendix. So what is appendicitis and what's the treatment available and how is it going to be done? The appendix is actually that's a small organ. We found it at the right side of the colon, at the start of the colon, which is about 5 to 7 centimeter long, depending on the patient and the age of the patient and the body habitus of the patient. So what the most commonly found appendicitis usually happen in the young people, usually the kids, the children who has it most of the time, but also it happen in the adults and the elderly. But most commons happen in the children. So what's the symptoms and sign that present with somebody who has appendicitis? The patient comes with acute pain. This is the most common symptoms. So it comes with a pain in the right side, usually gradually building, start from the abdomen first and then go to the right side, associated with loss of appetite, associated maybe with diarrhea, maybe burning in the urination, and the patient does not like to eat. So this the most common symptoms of appendicitis. When the patient has these symptoms, usually goes to the doctor, they examined by the doctor. The examination is very crucial to diagnose the appendicitis. Usually by the history and exam, we can reach the diagnosis of appendicitis. The exam is very severe tenderness in the right side and localized usually in the right side. Unless if the patient has delayed presentation of appendicitis, he might present with perforation. When the patient has perforation, means that the appendix is burst and that there is a lot of colon content inside the abdomen. This is why it has diffuse abdominal pain and fever, and which is different scenario than only acute appendicitis. So what other investigation we need to do? We have to do a blood test to make sure the white blood cells is count to see if it's high or low, and then we have to do maybe radiological investigation, which include either ultrasound or CT scan. CT scan is the main diagnostic tool we use to diagnose appendicitis, but the clinical exam and the history is very crucial to diagnose it. But the add on is the CT scan. When you diagnose the patient with appendicitis, the treatment is surgical. The treatment of appendicitis, the gold standard is surgery. So what we do in the surgery is also a keyhole surgery. It's about 3 small keyhole in the abdomen, and we can remove the appendix with very little difficulty or complication. And the patient can go home in the following 2 days after removing the appendix, and usually able to eat in the next day. Now, if the patient has perforated appendix, meaning that the perforation is throughout the abdomen, then we have to wash out the abdomen at the same time, and this is also can be done laparoscopically. And after cleaning the abdomen, remove the appendix, then we can do giving the patient antibiotics, which is very crucial after doing the surgery, especially if somebody has perforated appendix. Now, the elderly also have sometimes present with right lower quadrant pain, and symptoms will look like appendicitis, but at that time we have to do other investigation in the elderly, which include colonoscopy. Colonoscopy is very important for somebody who present with appendicitis or somebody who has a problem in the right side of the colon and elderly. So the colonoscopy is also important. Either you do it after or before, depending on the situation, but most of the people will do it after the surgery, unless if we do a CT scan and will show us there is a mass or there is a tumor or there is a possibility of cancer. Now, there is a new evidence now we can treat appendicitis with antibiotics only. Now, we don't advocate this kind of treatment, but now evidence is coming, and I think it can be used for special situation where we can treat the appendicitis by antibiotics. But this has to be under close observation, and the patient has to be strict in the antibiotics be taking, and has to be under follow-up of a surgeon, just in case if the situation get worse or the patient is require surgery at any time, and it can be intervened. But bear in mind, if you choose to treat the appendicitis by antibiotics, you have to bear in mind that's the possibility that the appendix might be burst, or it might cause perforation, which might cause more trouble other than just doing the surgery from the beginning. So in reality, appendicitis is a common disease. It usually affects the kids. The treatment is very easy and usually through a laparoscopic appendectomy. And the patient usually present with right lower quadrant pain and fever and loss of appetite. Thank you very much.